an ecology of conformity, but it is also an ecology of creativity. So therefore, this when in the societal system we do not have respect, as respect between the doctor and the patient, as respect between the political leaders. You know, you look at what is happening in the COVID time. Most of the illness also got engendered by immature political leaders who really behave so in an immature way, and it created a lot of anxiety. For example, political leaders pleading not against taking vaccine or taking hasty decisions, you know. So therefore, mental health and public health in terms of maturity of thinking, just last Sunday, we had a lovely conversation on morality and ethics by a great philosopher, Professor Ramin Jahan Baglo, and his Summa Moralia starts with this topic, the age of maturity. And I think health is a process of logical and spiritual. And I would just present these few lines from a great sociologist, Axel Honneth, who in his book writes about that how a paradigm of social normality must therefore consist in culturally independent conditions that allows a society's members to experience undistorted self-realization. That means as we are member of society, our health and well-being lies in us being able to realize ourselves, self-realization. And self-expression also. Most of the mental illness comes when we are not able to express ourselves. And that self-expression and self-realization is accompanied by mutual realization. And this is a book that Chitabhai, Chittaranjan Das, wrote in Odia in 2010 called Vyakti or Vyaktitva, Person and Personality, in which he has a chapter on Susta and Asista, ill and healthy. And he is also raising this sense that how to be healthy, it is not just enough that we are free from disease, and he is saying that maybe we have a little pill for disease, but for illness, we need to really touch upon our physical, mental, spiritual, and societal conditions. So with this, so it's a joy to invite Nimisha Behan and Amit Bhai, who can help us to begin with for around 30 minutes, both of you, and then we would be accompanied by conversation. So Nimisha Behan and Amit Bhai, please.
Sure. Thank you so much, Professor Giri. And you summarized today's topic very well. So, completely agree about the involvement of the social aspect, because without that, we cannot put the mental health in right perspective. Uh, the society, the environment where a person born, the family raised, and then the school goes, the office it goes, and then how everything influences the character building of that person, as well as the whole life, the decision making, the challenge taking, all those things that creates mental health of a person. But somehow, I'm not saying that it's all about that the family should do like this or parenting should be like that. That all plays a role, but beyond that, there are some genetic factor, like some biological factors, which also influences. And when you see the mental health, then yeah, of course, I am like more than 100% agree that the soul level healing or soul level, you know, the encompassing the soul is very important when you are treating the mental health patient, especially in the psychotherapy. But there is one more aspect. Once there are, as you mentioned about the brain, so when there are some changes in the brain structure, in the hormonal level, you must need some more medications and those kind of treatments which we say that ECT, or there are many other kind of treatment is also available. So psychotherapy plus psychiatry, there is two way of treating, and then as you mentioned, the integrated way. That is very important when these two things integrate well, and then that will be that should become the basis of any mental health condition treatment. And let me share my screen. I have prepared some slides to discuss today. Window. Okay. So, is my slide visible to everyone?
Yes, yes.
Okay, thank you. Let me tell you a very short story of my life, actually my childhood. You can see these kind of person, and I'm sure people who are living in India or abroad, anywhere in the world, uh, have got chance to see someone change, mostly in India, especially in the small towns or in the rural part of the world, of India. Also, the person looking like the dirty, shabby, not taking shower, long beard, long hair, or those kind of people we see. And then it when I was child, I saw something looking like this person near my home, and that person lives on the road every day, and they're sitting on the corner of the the crossroad, and somebody gives food, he eats, or no food, then sleeps like that. Sometimes I don't know who chained that person, but sometimes he's chained with a tree, sometimes free and just roaming around. That made me curious. Every day when I used to go to school, and I come back and I ask my mom, who is that guy? Who is that person? Then my mom say, pagal. He's a pagal. Like pagal is a Hindi word, and which means in English is a crazy person. So that's how we label these kind of person. So for me, for a like whole childhood, even my education time, and even now, if I see this kind of person or person looking this, one thing comes into my mind is a crazy. And I'm not alone. I think this is most of us think people are like this when they are behaving this way. They are crazy, insane, lunatic, or you name it. We also see these people, and you know that the similarity between there is one common thing between these guys and between this person, and that is the both people are suffering from mental illness, one or the other kind. So one kind of mental illness which can be treated with different kind of psychotherapy, uh, for example, depression, anxiety, panic attacks, those kind of things. Uh, but there are some kind of treatment which is need proper medication, psychiatric treatment. So these are the some just glimpses of people who can be mentally ill. uh, so there are variety and then whole spectrum of the conditions which we cannot avoid. What happened with either the people suffering from psychotic illness, schizophrenia, depression, anxiety, or a higher level of stress or chronic stress, these all conditions leads to one thing, in most of the cases, that is suicide. And according to WHO report, 1% dies every 40 seconds. But the 1% kills themselves. And that is very much alarming. We are sitting here and then see within 1 minute 1% died, like 40 seconds. So it's very alarming thing, and we are often ignore the gravity of this problem. And we know the name of many mental illness, and especially with the COVID, and after that, that depression, anxiety, those kind of things comes up, and then we started talking about that these diseases are becoming more and more common. In India, you can see more celebrity committed suicide. They killed themselves because they were either suffering from depression, or they were suffering from anxiety because of the COVID and lockdown conditions where they were not getting enough work, or maybe other life challenges. they get. So there are many other mental illness which I would like to bring your attention. And like we talk depression, anxiety as a very common mental illness, but these mental illness are just uh, accompanying illness with many other mental illness, like bipolar or OCD, ADHD, or many other schizophrenia patients also suffering from from depression and anxiety. So depression is anxiety is just like fever in the physical health condition, that any other disease and accompanied by this. And the precursor of depression and anxiety is stress. If you are having stress for a longer period of time, not able to handle that, that will lead to many, like, just start with depression or sadness, and then many other things come up. But there are some diseases which are genetic, so we are not talking about that. Just talking about the things which can be changed at our level, and preventable, as well as treatment can be done. And you see, because we have many such kind of disease, the prevalence rate, if you see that in four, one is suffering at any point of time in their life. For example, you are sitting in a picture hall or you are sitting in a classroom, then person in front of you or back or right and left, one of them is suffering from mental illness. If not, then you are suffering. So it is that common. Let's try to understand the common terms, mental health issues, or mental illness. So let's see the mental health, just like physical health. As Professor Giri also mentioned that mental health is not limited to your just mind, but yes, because mind or the brain gives you capacity to think, right? So mental health includes the capacity to think, feel, and act in ways that enhance our ability to enjoy our daily life or deal with challenges or making decisions or anything like that. But once there is some problem in the mental health, in any conditions, concerns, or issues or challenges in your cognitive abilities, emotional or attentional, that interferes with the enjoyment of life. Like, for example, you have eating disorder, or you have sleeping disorder, or you have attention deficit, or many other, emotional disturbances, then it hinders the enjoyment of life. You are not uh, utilizing the full potential, and then that also hinders the interactions with society and our environment where we live. Then comes the mental illness, and that is something which I would, this mental health issues and mental illness, this is a journey. So once you have some kind of mental health issue, and we often try to ignore that, or less prioritize that, there's nothing like that, then chances are very high that it changes into mental illness. So the conditions that affect a person's thinking, feeling, mood, or behavior, like depression, anxiety, PTSD, post-traumatic stress disorder, or even any kind of psychotic illness, schizophrenia, all these comes under this mental illness, which definitely needs medical or the clinical attention and treatment. Then let's understand what is mental illness. For our large audience here, I would briefly mention that a mental health condition that has a negative effect on the way an individual thinks. Your thinking will be distorted, your feeling will be distorted, and once your thinking and feeling is distorted, then uh, your behavior, it will come in your behavior, and that will be also impacted with. I would, because we are talking more about depression and anxiety, so here I would like to mention some symptoms which we need to keep in our mind, and that are like long period of sadness, frustration, worthlessness, or then when it get extreme, then cause of suicide or death, long period of tiredness, those kind of things. And anxiety is like feeling nervous or powerless, hopeless, those kind of things. Okay, but let me take a step back. And if you are not living in your present moment, you are thinking about your past, ruminating about the things what happened in the past, and because of that, your current status, your current mental health status is impacted, then and you're feeling sad or disturbed for longer period of time, at least more than 2 weeks, then you may be suffering from depression. But once you are worried about your future, what will happen next, what will happen, like during COVID, anxiety raised. Why? Because uncertainty was in the future. So once you are worried about future and that is impacting your present, then you are suffering from anxiety. So there is a big difference in depression and anxiety. Depression is about past and anxiety is about future. When you are not living in the present, either living in past or future, and that changes your mental health status, um, that is something, you come into this kind of frame when either you are in your past or in present, that changes your mental health status. But actually, let me briefly mention about the definition of mental health, that includes emotional, psychological, and social well-being. So social is also very important, additional to psychological and emotional, and together with the cognitive ability like reasoning or processing any learned information, those kind of things. But unfortunately, this is the most neglected areas of our public health. And uh, as I mentioned before, also the because this neglect, because we are not able to having sufficient knowledge or sufficient education to tackle the condition, then suicide rate is very high, and COVID has further impacted these kind of issues. The thing which we are, ignoring a lot, we give, like for example, in our society, if someone has broken leg or any physical health condition, um, for example, like diabetes, hypertension, or not a, like cancer, or any other those kind of sickness, and for example, admitted in the hospital or living in the home setting, anything, then it's very normalized. You will buy flower, you will care, you will understand that what person is suffering from. But if someone is suffering from mental health condition, then what we do? We try to make distance from that person. So there is no one or very less support available for a person who is suffering from depression, anxiety, or whatever. But no health is without mental health, and physical health and mental health is equally important. So there is a one single continuum also, where you are in the green zone, and then once your situation changes, you become ill and descend to the red zone. But there is one more, this model which I would like to mention here, is a dual continuum model, where one side your mental health is flourishing, another side is like poor mental health or languishing. One side you are suffering from serious mental illness, and the other quadrant is about no mental illness symptoms. So we all move in this four quadrants, where one side there can be optimal mental health with mental illness, and one side can be optimal mental health without any illness. Another side can be poor mental health with mental illness and poor mental health without mental illness. Most of the time, our health just varies in between. Any quadrant depends on our mental health condition as well as mental illness condition. As Professor Giri mentioned about how society, community, family, individual, everyone impacts the mental health of an individual. So let me briefly go to the next one, where we are going to try to see that how mental health getting impacted by the society. And the main thing which I found, and when once we are talking about the new horizon, but before talking about that, we need to see what challenges in at the present status, and then what best we can do for finding our new avenues. So main thing which is impacting at the societal level mental health conditions is inequality at the social determinants of mental health or mental health care level, and discrimination and stigma. Let me just quickly go. As we know that social determinants of health means your education, your food, your housing, your access to healthcare, and your income, your neighborhood, those all things. And you see, in the most of the cases, a person who are having either not proper, food or employment, or many, there are many other daily things which are impacting the mental health of a person. So those become the risk factors for the mental illness. If you see the mental health care level, I would like to briefly mention some statistics that 30, 13 points, like 13.7% of global suicide, it has already been increased. And but the access to mental health care is, you can see, only 49% had a mental health facility with services, or 26% reported no mental health facility within 50 kilometers radius. So once we are talking about mental health care, this is very difficult to access. And according to this survey, 59% reported that there is no de-addiction services, because substance abuse becomes a very big reason of mental illness, or become that consequence of that. Apart from this, awareness is lacking, as well as the support in terms of insurance. That is also 80% have no insurance for mental illness. So that is also some factors as a public health measures need to be taken care of. So once we are talking about public mental health and how it is playing the role, then it's playing the role in three main categories: promoting mental well-being, preventing mental ill health, and treatment and recovery. But what is happening here is starting from awareness of the symptoms to post-treatment rehabilitation, we have challenges at each and every level. So awareness of symptoms, or the health seeking behavior, it is already impacted because of many other reasons. Lack of resources, lack of knowledge, different kind of faiths, like religious faith, or just wear this ring or do this prayer or something like that. So there are some religious healers, alternative healers, faith healers. Those all create the increase in the mental health of patients. So, like, I'm not saying that they cannot be treated through that treatment. They can be treated, but if you're talking about clinical and medical healthcare, then there are some diseases which cannot be treated just by faith or religion. They need proper medication. And once we come into the this medical sector, we have challenges with the professionals. We lack the professional who can treat, either psychologist or psychotherapy, or counseling, or therapy, giving any kind of therapy, or psychiatrists, the doctors. We lack them. There are discrepancies in the diagnosis, because um, there are not much training and education. So those things are also impacting that. And also this mental health condition, the symptoms vary a lot. With each unique individual, it varies. So there are higher chances of misdiagnosis. A person take medicine for a longer period of time, say 5, 10 years, for example, depression or anxiety or bipolar, and then it turns out that person is suffering from some schizophrenia, because the depression is just one of the symptoms of some psychotic illness. So it is very complicated. So that also creates a lot of problems. Then initiation of treatment, because health seeking behavior is very um, skewed once we are talking about our mental health illness. And also the traveling distances are high. People who are supporting financial or taking together, so that also challenges adherence to the care, because there is no follow-up. Once a person comes, psychiatrist or psychologist give medicine, and it is on the patient if it is coming back or not. So that is the problem. Then post-treatment rehabilitation is again the problem, because patients don't want to come because of a lot of taboos and the stigma around that. The third thing which society need to think, um, creatively is discrimination, labeling, and stigma. So once we talk about the stigma, it comes from a Greek word, and from where it originated, let me tell you, it originated from uh, some criminals, or in the ancient time in Greek culture, that they used to mark with the some very a sharp rod or something, mark the criminal, that they are criminal or something, and that they are stigmatized, that they are not good person. And from there, this stigma word comes. And now we are using this stigma against many other things, but one of the things is the patients suffering from mental illness. Discrimination is there, stereotyping is there, labeling is there. So for example, crazy, or those kind of things. We often use these words for the person who is suffering from mental illness. It's just illness, but we name then social exclusion. And nobody wants to marry that person or sit next to them or talk to them. So those all things are there. The main reason behind this is lack of awareness about mental health issues, because we know a lot about our physical health condition, our physical health, but once we talk about mental health issues, still we are lagging a lot behind. Is still guessing, assuming, and just finding some ways to handle the problem. But we are not cracking the problem because we don't know. Not only the patient side, but also the provider side is lacking. And we have a lot of, just a lot of myths and misconceptions in our society. For example, this one, that the person is this family don't want to buy home near psychiatric hospital, because what if the wind changes and my kids all catch schizophrenia? They're thinking just because of the wind, they like they can catch any mental illness. And it is very true that this kind of mentality is there in our society. Nobody wants to accompany a mental ill person to the hospital. Even in Hong Kong, I'm seeing that person, they nobody wants to interpret, nobody wants to go, because they think that it is a contagious disease. They can also catch that. And also, what if someone sees me going to psychotherapist or going to psychiatrist? What will happen to me, my family? So everybody will think that I am a crazy person, or I am a mentally ill. So those kind of things. Main why it happened, because um, we have the tendency to, uh, you know, um, misinterpret mentally ill patients as dangerous or incompetent, or this is a permanent illness, cannot be treated. But these are all misconceptions. What next, right? Next is we need to, just I will tell you some techniques that we as a, just as a beginning we can use uh, for starting with mental health stigma, because any intervention will not be successful if we are not handling the problem at the grassroots. And the problem at the grassroots is starting with lack of knowledge or awareness, and also the stigma or the taboo around that. So you just remember stop, okay? And stop is the stereotype people with mental health condition. You ask yourself, or you see in the person. Then trivialize people with mental health conditions or condition itself. Do you label that thing or the person or disease or symptom? Often people with mental health conditions and patronize people with mental health condition by treating them as if they were not as good as other people. So this four things you need to think about yourself, that are you labeling or stereotyping the conditions or the person or the whatever is the behavior or everything, then you can use this as stop me. You don't have to give yourself another perspective and then answer yourself. And there is 5 ways to end mental health stigma. First thing, educate yourself and your children about that. Share real life examples with mental disorders and how, what are the success stories. Then explain mental health ways of like symptoms are there, and listen to and support each other. If somebody is trying to tell you something about their mental health, then give them non-judgmental ear and listen to them. What if a family member is suffering, and what kind of support you can give them? So first thing, encourage patients to take doctor's appointment. Start with GP. You take them to the GP. GP can give you like general practitioner. They can recommend you where you can go. Psychotherapist or psychologist or whatever is needed, they can guide you. The second thing is remind your family member to keep taking medicines. Never ever suggest your family member to stop medication because of side effects, uh, because this will lead to more damage. And it should be stopped in a proper manner if it is needed, and in the supervision of doctors. So don't give them that kind of advice. Then any other like alcohol or drug abuse, try to make them avoid. Stress level management, you can help them, and diet, sleep, uh, and maintain social skills, and limit power struggle. Okay, because your family member already suffering, and you show him the power that either you are a father or mother and show your order that, or any other family member, that should be avoided. Then you need to ready to accompany the person for hospitalization or calling ambulance. Self-educate and talk to yourself and other family members also, or find or make peer support group. That's how you can help your family member. So there are some signs. As a layman, as a person who has no knowledge about mental illness, you need to have some kind of understanding that if one of your family member is suffering from feeling anxious or worried or depressed, unhappy, emotional outbursts, sleep problems, appetite change, diet change, or very quiet or withdraw, or having some kind of substance abuse, feeling guilty or worthless, they talk about this kind of thing. Or there is changes in behavior or feelings. So you can spot these things, and if it is uh, not one day thing, right? It should be like 2 to 3 weeks continuous, and that person is not able to come out of that mode, then a professional help is needed. You take an appointment of any nearby doctor and try to know that if there is any mental health condition coming up or challenges, then where should I go? What should I do? So open up, talk with the doctors. Um, so there are one more thing that the talking is very important. Either if you are suffering or any other person is suffering, you need to share it some profession, or nowadays it's very good that more and more helps are available on your phone. On online services are there, so you can directly talk to them, and don't keep the situation with yourself. Just try to share more and more. That will help anyone. In this COVID thing, we are suffering from social distancing, quarantine, isolation, disease, this, that, and that is raising our stress and anxiety. If you see that this stress is precursor of variety of medical mental health conditions, then it's very important we do some intervention at this level, individual level, and that's where Dr. Vanchi is going to talk more. But I would finish my this presentation with a poem written and narrated by Erin May Kelly, and this poem sheds light on the human rights violations that are still far too common in mental health services around the world. And the poem also explains what mental health care in the community can and should look like, and the tremendous difference that care provided with respect for people's human rights that is focused on recovery can make people's lives, right? The poem was commissioned by WHO for community mental health services with the right-based approach. The person who is suffering from mental illness is not a less human. So that kind of mentality and the perspective should be developed. And the poem is like this: what happens to a person when they are treated as less than human? When they are treated as a truncarized problem that needs to stay docile and become more prisoner than participant. There are more lines. I would just mention this, that the mental health care services, either at the society level, community level, or at the healthcare level, it is not very positive. Situation is not good. Once a person needs those kind of services, and that is also becoming deterrent for anyone seeking the help. So once we are talking about the new horizon, very important to see these perspective also, that make a conducive environment where person is able to speak up and can access the proper kind of healthcare services that both can help to uh, sustain their mental health. And thank you so much for listening in. Now I'm going to stop sharing, and I would request Dr. Vanchi now to share at like how at individual level mental health can be managed well. Thanks.
Thank you. So, thank you, Nimisha. And I'm just trying to find out that it's just.
Uh, on the screen there is small arrow on the bottom. That
Arrow
is
like three dots, right? Share.
oh, okay. So have you opened it in different window, right?
Just a moment. I'm just trying to see if I can do it again. The zoom, or it is to be done in a different way?
No, you press this one again, and uh, so there are three options, right? A
Mm-hmm.
window, and what other options are there?
There is a window.
Yeah.
Just a moment. And because it is showing me only that the screen and not share.
Or is it? Mm, try again.
So more options. Board change layout and all.
Sir, let me help
Yeah.
you out. Sir, let me help you out.
Okay.
Sir, means on that present now, and then you will be finding three tabs: your entire screen, a window, and a tab.
Mm-hmm.
So click on your entire screen.
Just a moment. So I'm doing it on the entire screen.
Yes. Now pressing on entire screen.
Hmm. Okay,
There
pressing
will
there.
be one that tab means that box will open. Over there you have to select,
Mm-hmm.
means you have to click your cursor on that box and then share. After getting done with the same, you can
Hmm.
open your PPT without being staying on this interface that
Yeah.
yes,
Yes,
now you
yes,
have
it
shared.
is coming.
Okay.
Yeah.
Okay. Thank you so much.
Yes. Yes.
So I think doing it all the time on Zoom. So this is first time here. Okay, guys. So is my screen visible to everyone?
Yes, yes.
Yes.
Yes, sir, it is visible.
So as Nimisha mentioned, we were talking about new horizons of mental and public health. So I personally believe that whatever technology has been doing or whatever things have been happening, so one of the most important things is that how we are able to change the perspective. Are we able to build in that positivity in the society, both in the medical field as well as patient relationship with doctors and others is concerned? And that's how the happy and healthy society can be brought up. So one of my famous quotes of Mahatma Gandhi is like, happiness always brings positivity, and positivity brings happiness. But what is happiness? It's the perspective. Happiness is when what you think, what you say, and what you do, they are in harmony. What you think, what you say, and what you do, they are in harmony. And I think, unfortunately, this is the thing that's missing in today's world a lot. And that's why we see lots and lots of mental crises happening at different perspectives and different points. But when you want a new horizon, as far as the screen and the prism for seeing the mental health or the public health is concerned, it's a new mindset that has to come. And when that new mindset comes, you have new results. And that's what we have seen in these 2 years, where technology has been helpful. Even consultation during COVID has changed. How even we could not think of times wherein you can have a video call and see a patient, or people having their schools and classes and everything online. And same has happened to healthcare as well. So it is digitally moved to a different level. But when we are talking of these new perspectives and new horizons, what is that we are missing at different aspects as far as the mental health is concerned? Still, we are seeing that people shy away from whenever they have to ask for a help. Definitely, we have grown from the past, but still, there are moments wherein we don't want to discuss about it and open. We want to walk away from it. We don't want to start over things, because every person, remember, life is such a cycle where one problem is over, another is ready to catch you up. Many times we plan that just my problem will be over in 1 year and then everything will be okay. By the time you reach there, there is a second thing that is basically waiting for you. But that's life. When you have challenges, then only you will survive in this life. Otherwise, everything which is monotonous, you will not even live. So you have to broaden your horizons when you are talking about these things. And we have to have a three-dimensional view and not a two-dimensional view that we mostly have in the health sector. So in this picture, you can see it's all about perspective. The person is seeing 4, and the person on my right side is seeing 3, and both are right. And that's where the arguments, the discussions, you must have seen many times, even it happens with all of us, wherein you feel that you are right, and the other person feels the other person is right, and then we have arguments, we have discussions, we have so many things happening. And that happens in healthcare as well. That's the perspective which we are missing. So when we have to build up this perspective for having this positive view all across, and for mental health or for public health, we have to focus on humility, as Professor Giri was mentioning. Thankful that we have. And we don't need to be perfectionists. No one is perfect in this world. There is no problem in everything. If you have done a mistake, if you're wrong, it doesn't matter. I just want to share this sentence with you. See, the sentence it has two different meanings if we just speak it in a very different way. So the first one is, I have no confidence that your team can provide us with the resources we need. And if the same thing is said in a way, I want to help your team devise a solution to ensure we have the resources we need. So in the first sentence, I'm becoming very rude, very direct, while in the second, I'm telling the same thing, but in a way which will not be hurting to the other person. So whenever we are communicating, whenever you have a communication, whenever you are with your friends, whenever you have pressure in your health problems, or even you face sometimes a crisis, a stress, anxiety, depression, or any such situation that happens in your workplace or in your office place, you have to focus on positive emotion. You have to focus on engagement with people. You have to focus on relationships, both personal as well as professional. Remember that these relationships have an important role in our lives, and most of the times we ignore it. Many a times your father, mother, or sibling, or any close friend is calling you, and you will ignore that phone many a times, thinking you will call back. But if you get an important number of any important VIP person, you will just pick that call that very moment. But when you are in crisis, that VIP person will not be with you, but your parents, your friends, your siblings who are very close to you, whose calls you ignore many times, they will be with you. So you have to understand the meaning of life. It's very important. And then the accomplishment and the achievement. Every day, every little work that you do, it is an accomplishment, it is an achievement. Never see yourself through a negative prism. It's very, very unfortunate. You have to see yourself through a positive prism. Do be open to criticism, but see yourself through positive prism. So when we talk about the health sector and especially the mental health or even the public health, positive emotions always have a very, very strong role, because whenever we are dealing with patients, whenever we are dealing with health sector, it is not a construction material. It's not a building. It's not building highways. It's not building railways. It's people. It's emotions. And you have to understand those emotions when you are dealing with such people, because whenever we are in such bad situation, we also want people around us to understand that. And that's where lots of times we struggle. We always feel that my friend, my boyfriend, my girlfriend, my father, my mother is not understanding me, is not understanding my position. Like simple things like you had a rose day just 2 days back, or you had a proposed day yesterday. Many times, many people feel even for those small things. For some, it matters a lot. Maybe for others, it doesn't. But we have to be inclusive in these emotions. So when we talk about health sector, what we miss in India or even in West, in India it used to be there a lot. There was a relationship between a doctor, a patient, a society, and you would consider a medical person or even someone who is just practicing medicine in your rural area or urban area just next to God. And that is why there was that relationship, that bonding. And we would see many a times people would communicate a lot, would talk a lot, not like present world where we are busy on mobile phone, on digital phones, seeing WhatsApp, Facebook, how many people like my post, how many people like my Instagram, how many people like this. But believe me, all these likes, all these comments won't matter in life. When you will be in crisis, 95% of them won't be even there. So it's very important to understand good relationship. And for that, you just remember one simple word, mystic, and our country is famous for mysticism. And for mutual respect in any your all stress and talk to them and be open to them, because that's very important. Even when you're dealing with the pressures at home, at office, at personal life, you need someone with whom you basically unload your things. And inclusivity and compassion. Compassion for others, compassion for your own self, and compassion for people who matter in your lives. And three factors which are very important for positive relationship is emotional intelligence, social intelligence, and intellectual abilities. You have to focus on these things. And in emotional intelligence, whenever you're dealing in such emotional situation, be calm first thing. Don't be reactive. Keep the things in perspective. Have a sense of humor, because smiling, laughing, having light moments are always very important. Build resilience in yourself whenever you're dealing with any mental health crisis, whether it is breathing exercises, whether it is meditation, whether it is having an aromatherapy or sharing with people or communicating. You have to, because that will help you in bouncing back from adversity. Learn from errors, and we all learn. This is a life wherein it is like a lesson for all of us. And you have to be decisive, because many times we are not able to arrive at a decision. We are indecisive and we are not more important than being sympathetic. Work productively, and you have respect and honor and same the other person has. Believe in diversity, believe in inclusivity, because it's the most beautiful thing, and it will teach you a lot in this world. And then be a good listener. It's very important. Contributing positively to projects, because that's again very, very important. Whatever project you are into, You should basically be positive about that, whether you're doing a research, whether you are studying, whether you are into something else. And intellectual abilities, all of you have, all of us have that intellectual level. We just have to identify them. We have to prioritize them. And we have to be flexible, have those specific skills, be a visionary and a good organizer in things that we are doing in life, and manage your time effectively. One thing that you must have heard a lot is negativity. Don't be negative, you should be positive. You are negative, you have so many things. Remember, there is nothing like a bad emotion. No emotion is bad, it is just that moment. And all the thoughts, all things are valid. There is no problem in being sad or having negative thought process. The only thing is it has not to dominate the other processes. We don't have to take pressure of positivity also, that everyone around you is talking about positivity. You have to be positive, you should think positive, be constantly cheerful. No, we can't. We're a human being. And we will have emotions, sometimes good, sometimes bad. It's very easy to say that we'll be happy all the time, but it is not. We see so many difficult situations in our lives. So that you have to think of, and you don't have to take that pressure of positivity. And you don't have to dismiss negative emotions. Just accept negative emotions and process them in a healthy way, because they will teach you a lot in life. So encourage positive thinking, positive affirmations, but also encourage negative thinking. The only thing is that it should not dominate. That's the only thing. So you have to respond to emotions. Now, one thing that we always call is automatic negative thoughts. What we call in short is ants. Our brain, it will always put a lot of focus on energy of negativity or bad thing. If you see a program in 1 hour, say 90% things happen good and one thing happens bad, that is what will remember in your mind. It's a human tendency to always focus on something which has gone bad or something which is negative. So that is how our brain is processed. So since we are surrounded by it, we don't have to just both. That's wherein we can get more good things and we can learn in life. And the best thing is that we have to learn from our negative or sad situations that happen in life and train your perspective, train your brain like that, both in health sector and otherwise, wherever you are. And in relationships, I told you, whether it's personal and professional, believe me, the relationship sector is so important in our lives. So you should be a positive leader at home, at office, or at the study place or in university. Create resources that you have, interact with people, communicate, manage things positively, and reinforce that positively and learn from negativity. And you have to trust your own self, because when you lead, it's very important that whatever you want in your lives, you will never have it if you are in the same situation. You have to do something different which you have never done. And that's for you whenever you are moving in your life, it's very, very important. And some short tricks to stay positive is that BPS, we call it best possible self. That's an exercise which boosts optimism and positive thinking in you. Like you could just sit lonely in your room somewhere and just imagine yourself in the best of the situations that you want for your own self. Set up a stopwatch for say 10 minutes and 12 minutes and write whatever is coming into your mind. Don't matter about the grammar or other things, just focus on feelings and thoughts. And it will help you a lot in knowing your own self and the emotions. And therein you can see this positivity ratio and negativity ratio. How much positive the thought process is or how much negative the thought process is. Some simple techniques is like, you can sometimes, when you're feeling very much pressure, go in front of a mirror and see and talk to yourself in front of mirror, and whatever you feel like, if you're not able to share with anyone, share it in front of mirror, and you will see that you will be in a much, much better situation. Sometimes you might have a lot of stress and you can't do anything. The best thing is that if you have any good oil in your room or in your hostel or in your office place, just have that fragrance around, and that aroma will basically act wonderfully on your nervous system and relieve you a bit. And we have some breathing exercises which we can show next time whenever we have time, or we have many other de-stressing exercises that we can show to all of you. Finally, I would like to focus, like, life is like a story, and this, what I like best is passenger on a bus metaphor. Just imagine that this is the bus stop and you are the bus driver. You are driving the bus, you have passengers in the bus, you are dropping one passenger at one stop and other passenger is coming up, and this bus has a destination. Now, if we imagine that you are driving the bus of your life and you are driving. Now, you are driving the bus, you have people coming in and people coming out. This is the thought process which you will have, and lots of friends which will join you. Some friends who were your friends at the age of 10 may not be today your friends, are not with you, or people who have not been on there now, who were with you 5 years by now, or who will be with you 5 or 10 years from now. Then these people are talking, someone is shouting, someone is telling you, I want this, I want that. These are the kind of inner thought processes that you have, your own mind has, because our mind is like a monkey. It will keep on disturbing you on right, on left, on up and down. But if you don't focus on your driving, if you don't focus on your steering, you are not going to move, the bus is not going to move, and you will not reach your destination. That's what life is for all of us. We have to drive in spite of all the difficulties. Thank you so much, and now I'm open to the discussion, and I just stop sharing.
Thank you.
Thank you so much. And back to Professor
Thank you
Giri.
so much,
Dr.
Dr.
Randhir.
Wanchoo. Thank you so much, Dr. Vandan. We can continue our conversations. As Randhir was kindly suggesting, let us begin with Dr. Rakesh Chaudhary, please. And given the time, I request you to kindly be brief, 2 to 3 minutes each of the participants, please. So, Dr. Rakesh.
Okay. Dr. Wanchoo and Ma'am Nimisha, it was wonderful listening to both of you.
Thank you.
You know, as a fellow practitioner who does a lot of social anthropology of mental health, there is nothing which can be disputed in what you both have said. But the question is, it is in social context that mental illness need to be localized now. You know, it is also the anthropology of a particular place in terms of its culture, its values and tradition, that where something that is considered normal would be considered abnormal in many other places, and thus the response and the reaction of the family member or the larger society. This is my first observation. My second observation is about this, hashtag of positivity, hashtag of children with intellectual disability, that at times their facial expression, their gestures may look like that they are cheerful and happy, but actually it's very difficult even as a professional to understand what exactly does it mean because there are, we all are aware there are three levels, those who are mildly, moderate, and extreme. So I would not talk about extreme because I have not worked with them. But in case of mild ones, what I have realized that all this happiness about mental health, it comes with a lot of communitarian effort. When you bring them together towards a common purpose, that not might be earth shattering or having a paradigm shift, but that if there is a focused intent of a particular playtime, lunchtime, even that of a personal hygiene, which based on the caregiver's perception, if it is taken as something joyful, I believe if it cannot become mental health is only a scale. According to many of me, I might be on one extreme or I might be on another extreme. So it is very, very debatable. So I would say that let's not start measuring mental health, but let's try and construct mental health with a very, very localized perception. So more researcher needs to come into this area. This is my comment. I mean, thank you so much, both of you. It was truly a pleasure listening to both of you.
Thank you. Thank you so much,
Thank
sir.
you, Professor Anand Giri. Thank you for the chance.
Thank you. So,
I would just like to mention briefly about the WHO definition of mental health. That includes like psychological is one part, but emotional and social well-being.
and
So it
also
is there.
spiritual.
Yes, emotional, spiritual, and social. So that all is there. And as you talk about the contextualization or they are doing, but that contextualization is a must with the local culture included. That how respond. There is one question also about the
अरे अरे अरे
or the
मैं टॉक चल रहा है,
knowledge about mental health.
टॉक चल रहा है,
Without
जस्ट
trying to
हाफ
figure
आवर.
out, humans are social animals, right? As you said that the kids should be when socializing or having playtime, those kind of things. So being a human, the first need we have been social with the society, with more humans, with the family or the tribe or community. So that is the need, and that's why this all that emotional health related issues raised during COVID because we were isolated. We are isolated actually now also. So you truly pinpointing pointing the problem that being social, being in a group, being in a community itself is a very enabling and protectiveness or the factor for the good mental health. Thank you. Maybe Dr. Wanchoo would like to add more.
Thank you.
Absolutely, I agree with what Raffles also said. See, I have one thing that I have also observed while dealing with patients and people all across, that one, as you talked about the stigma, which is the one thing that we have to definitely focus on still, like wife and the kids that are with. So one thing we all, even COVID has given us opportunity that we at our levels, whether it is the society, the NGOs, the college, and I'm very, very happy that in our country also and otherwise also in the West nowadays, youngsters are very open to this. They now are open to talk about it. What was not a scenario, say, 15 years back, today they are open to talk to it. And that's one of the best things that I feel has come up. And that's our hope. I'm sure that we.
Thank you. So I request a respected participant to kindly ask question in the chat box. And meanwhile, I would like to invite Professor Gyan Gului to kindly share his view.
Thank you. I'm audible.
Yes, sir, you are audible.
I'm audible.
Yes, you are.
Yes.
Well, it was really very, very interesting. All aspects. I must admit, for instance, model but not mystic, and so in mystic I have to go deeper into the content. But my of the content, I very much agree. But I think there is a problem in it. That is, there are the societies which have been dominated by the liberalistic or neoliberalistic ideology. A model of behavior and of thinking and of relation with the other members of the society which goes in many aspects directly against, for instance, Sperma model or mystic, or also become a positive leader and so on and so forth. It is rather the model of a psychopathic individual who has to make and to think only exclusively at his own interest and his own affirmation in the society in order that society functions. That is, you have to be completely egoistic, close to other perspectives and to other individuals, and you have to prosecute your own interest and only your own interest, because only so the society can function. And this is my opinion of the problem, because it goes against more or less all these wonderful aspects which we have been hearing during our conference of today. It is the problem of direction and orientation of at least some mainstream presence in the society. It is the model which I would call, I do not know whether it is the correct feature in order to call, to define this model, but that of the psychopath individual who should out to be so in order that the society can be increased, developed, and so on and so forth. And this is my opinion of the problem, which goes against, I repeat, the wonderful content of today. Thank you very much.
Thank you. I would request respected speakers to kindly note down these questions, and you can answer this question at the end. So I can see Dr. Inderdeep is an associate professor from Kolkata. Sir, are you there? Okay. So
Randhir, we have two friends who have raised hand. I think she is Tamil, Nabil, and Pankal.
yes, Dari, please unmute yourself and ask your question.
Sir, not a clear voice for you.
Okay. So, Dr. Tiwari, would you like to ask any question?
Sir, question come an observation I would like to present here at this platform. First of all, I would like to say thanks to both distinguished speakers for making us understand talking about mental health, I have an experience. My PhD supervisor, he went through means that experience. Around 10 years before, his mother, she was 80 plus, and she was behaving abnormal. Means she was abusing madam and abusing sir and his daughter, and she was leaving the home. Means they try to keep her inside the home, and so out of their duty schedule, it was very difficult to manage and take care of mother. So sometimes they were also getting irritated from that abnormal behavior of their mother. So one day, some person relation suggested them to take their mother because physically, but that behavior was abnormal, and because of that, you know, unusual behavior, they were facing so many issues in their personal life. So they take Mataji to a psychiatrist, means a doctor who can observe her condition, and that doctor suggested that is a kind of mental disease, old age mental disease, and that doctor suggested sir to take care of means his mother, because it is not that behavior is not uh, uh, exercised by his mother knowingly. That is a kind of mental issue. So at this platform, as I can see, many people are there connected. I would that if there are aged people in your family or in your surrounding, and if they are not behaving properly mentally, they are doing something unusual. So it's right time to consult a doctor and take care of them. So that's it, sir. Thank you so much.
No, thank you so much, Dr. Tiwari, for letting this message out. And definitely, this is such a wonderful message you have given. And this happens. This happens not only with the like elderly mother, but yeah, elderly or the old age is one of the also predisposed factors uh, when like for elderly and once you are busy and working, your partner is also working, and there is no one dedicated to take care of the elderly people in the home, and once they start showing these kind of symptoms, it is extremely difficult to handle. And I'm not also not complaining the situation of the the couple, because it's quite understandable, but understanding that this is not intentional and this it can be helped.
It is the mail ID, and yeah,
Yes,
this
yes,
is your
we will provide the YouTube link as well as
this
PPT.
is
Okay.
very useful and important. Your language nice.
Okay. Thank you. Thank you.
Thank you, sir.
Okay. So,
Maybe
hmm.
Randhir, you may share your thoughts. Then we
uh,
can request Minati.
okay, okay, okay. Thank you so much. Thank you so much, sir. And it was very insightful and informative session. I also teach psychology here, so I feel the big challenge of psychology is common sense, and people really do not like to talk about mental illness or mental health for that matter. And you really beautifully articulated the importance of humility. I think humility begins with forgiveness. So forgive yourself for not knowing better at the time of crisis. Forgive yourself of giving away your power. Forgive yourself for the survival patterns and the traits needed to be. So something we have to normalize things. Understanding. So I really appreciate the cognitive dimension of thing, because many of our particularly mental illness is caused because of our misunderstanding or lack of understanding. So some things which I often tell our students, things to remember. It's okay to cry. You matter. Bad thing happens. You are not alone. Again, that is why somebody asked in the chat box, what is the indigenous way of dealing with the trauma? It is sociality. It's okay to ask for the help. Now what happens, that is the very narrow cultural understanding which prevails in urban area, that we don't ask for the help even when we need something in our life. And the best thing that you remember is you are not enough. So because you both are the practitioners, so my question is like, I need to we need to have a kind of awareness in society. So on behalf of our SOHSS Chakra, we sometime also develop a kind of module. First we have to sensitize our students. Even I taught in Sarda University. There I found like people are not ready to talk about this mental illness. Even a student fraternity, they don't like to talk about. So awareness is very lacking, and that is why India is we can see the World Organization Health report. We are mentally we are big in number when it comes to mental retarded people, but we don't having awareness. So let's develop some curriculum or some courses, and you can be our nurturer, so that we can sensitize people towards mental illness in great manner, good manner. Thank you so much.
Thank you, Randhir. And I just want to quickly add one thing, as you rightly said. I don't know, people who have joined who might be from India, have they ever heard the name Meher Baba? I don't know if any one of you have heard. So Meher Baba was one person in our country who would only meet people who were mad, whom we call pagal, or people who were on the street. And I have personally heard from my parents and grandparents when he had come to Kashmir as well. And the only thing he would do was that he would see all the mad people in the city, collect and invite them, and have meals with them, lunch, dinner, and things with them. And someday, because he was very, very spiritually evolved,
Please, Minati is also presenting a poem of song. Before that, you have some thoughts, Minati.
Hello, good evening everyone. I hope I'm audible.
Yes.
Thank you, Ananta for the opportunity to speak. Actually, this is very favorite subject.
You are audible, but you are not visible. Kindly.
No, visible she is. I think from the other side. She is visible from two.
Yes.
Okay, now.
Yeah, thank you, Dr. Nimisha and Dr. Amit Wanchoo, for a very wonderful talk on this very neglected subject. I must say, because it has been not the way we should scale our mental health and physical health. It has not been. We have not reached so far. You would agree with me, I know. So, the very topic of this new horizon of mental health and public health, the same name, there is one organization in Bangalore. I mean, they provide support to all the people. So, as far as it goes, right now, actually, Dr. Amit was speaking, and I want to refer to the first song, what Ananta was telling, the pagal, the mad. When if you are not fit into some society's so-called norm, then you are called a pagal or a mad. That means it may be sometimes very spiritual high, sometimes maybe mental breakdown, but both product of the same evolved brain, brain system, that power to transform. It is not, it is always called mad. When as a volunteer and as a counselor, I have worked with many disabled children's parents and many people. But what I find, I had a small thing to present, but there is no time, so I will not present. I just when as a counselor you talk to people, they just close up. They don't want to open up at all. They think that is something different, or people will consider us as a mad like that. When you talk to them as a friend or as an acquaintance, they will open up. But the issue is, they will not take you as seriously as they would do with a professional. I find there is a disbalance that how, fill the gap. Dr. Nimisha was telling about religious healer and that spiritual therapy. I think the religious healers are doing more damage to the society than to do the good. And there is a new research, it shows that spiritual therapy actually is helping. But the thing is how to penetrate into the grassroots level. With us today, Sudha Ma'am is there. She works with the grassroots level. She must be knowing the village, what type of condition the females face. There is even, this is the sadness, that in all the educational institution doesn't have a therapist, they don't have a counselor. When you go and talk as a parent, when you go and talk as a counselor, that becomes difficult to, you should not say mobilize, to accept your views for the parents and other things. So first, I feel as a health professional in the health communities, we have to identify the collective properties of this physical environment, that influences the outcomes. There are many things when you see, first you have to work on that. The inequalities, which clarifies the mechanism through the socio-economic hierarchies, racism, discrimination, stigmatization, and influence of all the physical and mental health outcomes. So, in my suggestion, it should be the macro level of understanding of each and every level of the society. That will help. And you have to, as a health professional, you have to evaluate the health performance, how it goes. And the intervention and the expanding the scope and strategies for the social and behavioral psychological community, and establish the way to train, to integrate whatever the health related issues, knowledge to every discipline of the society. Like Professor Randhir was telling, should be taught in every stream. So minimum things. So that is what I'd like to say. And please put some light on this, that as a counselor, how to bridge that gap. Thank you. Thank you so much for this opportunity.
Thank you, Minati.
Thank you, Minati.
Any thoughts from you, Nimisha Ben, about this question?
Yeah, you have raised such a wonderful thoughts and the grassroots level real-time challenge that we talk about all these things, but these are the things for the people who are ready to accept it, who are like at the end where they are understanding all these things and they can apply. But there are big mass who are still not ready to accept that there is a problem. Like elephant is there in the room, but they don't want to accept it. and he completely denied that there are any issue with their children or for themselves or their any other family members. So instead, they will talk about it and they will say any their perspective. They want to hide as much as possible. So the change, like how why they change the people or lock the people, or the someone who is suffering. The only reason is because they want to uh, hide from the society, from the community. And why do they do this? Because it's directly related to the pride of their family, and they want to anyway save the face of the family, because we are collective society, right? We are not in the individualist society. So for that mentality, that anything happen to one family member will ruin the reputation of the other family members. So for example, as Dr. Vanchu mentioned, that if one of the girl of a family has any mental health condition, then rest of the brothers and sisters and other person who are living in the family will get influenced or will get impacted, either for their education, for their marriage, for their employment, or for any other sake. So because of say this kind of mentality, this is happening. And the second thing she mentioned, as a counselor, how she can connect with the local community is main thing, like raising awareness is our goal. As well as if you are a friend of that family, uh, that level of therapeutic relationship, you can say, or any kind of do that, there comes the role of relationship. Once you make that relationship, then the person will start opening up, and then they will feel their, the receiving antenna will open. They will understand, okay, whatever you are saying, that kind of confidence is developed, then only they start accepting that. It will take some time. It won't happen in one day, that you go, you tell your professional knowledge that this should be there, this should be this way, that way. They won't listen. Not only for mental health, for any sake, you go to rural area of India, people are, very rigid in with their beliefs, whatever they are believing. So changing the belief in such a manner that it will not, it will open their eyes, that yes, uh, they start realizing that yes, this is the way. Yeah. So
Thank you.
I think making that relationship is important.
Thank you.
Thank
I
you.
just want to add that one of the main things in counseling always remember is what I personally think is the basic principle. Get more response. So as I say, I use illness, we use wellness for counseling. Thank you.
Thank you so much. But in this process also, I feel one more, no, like that burnt out. Always will be like so much of thing. Everyone has to share so many things. You have to. That also sometimes creates that hazard, you can say. I mean, no time for yourself to distress. Like, thank you so much for a valuable tips.
Thank you. And
Psychological point.
and also thanks. But can we
But
just
if
before,
this is there, not because that were very. So I will just read out the poem
yes,
poetry and let him do the.
yes, yes,
So
yes.
this is
Please.
this is also this is from my book.
just 1 minute, Minati and Randhir.
Yeah.
And we are already late, but we have the presence of Sudha and Satyabhushan Bhai in the chat. Satyabhushan Bhai. Sudha.
Yes, thank you, Anantji.
Please,
Sorry, I
please,
can't go on for the picture
Okay.
because I think there is some network problem here already. Thank you so much. In fact, I didn't know about this program. It's till Minati sent me the link immediately on WhatsApp. By that time, I think I missed Dr. Nimisha's talk, and I think I joined in the middle of Dr. Amit's talk. And I missed your talk also, Ananta. Anyway, I'm very happy to listen to all of you, and definitely it's really needed, and it's not just for us; it's also for ourselves. First of all, to have our own confidence and our own, there are a lot of things keep happening. Like all of us are human beings, we have to go through several things, even though we are working for the people, with the people. I mean, because it's my case, it's like working with women and children at the grassroots gives me a lot of, in fact, I can't say it's a stress for me. I'm just, sorry, I would like to share a bit of my experience. It's not but when I listen to them, when the way they are going through their own issues, I think it's a strength for me to see that how others are problems, where how we need to cope up with that. And also sometimes this catharsis process, which goes very well with them, I mean with us also, so it helps a lot to come out. And as I think speakers also mentioned about it, how we need to come out of it, how we need to, the importance of sharing, and with empathy. Empathy is a very, very important thing, I feel. Um, so when I will, I mean, like, and also Dr. Nimisha also very clearly she said about even Minati also, cultural issues. There are lots of cultural issues. We think that, it's very difficult to distinguish sometimes for our rational thinking and rational, our scientific understanding. Usually these things cultural and it look like superstitious, but for them it is not superstitious. It's very, very, it's like that is where we, some kind of barriers, we understand there are barriers for them to break the barriers, so that for any awareness, these barriers have to be broken. So we usually use that word awareness and educate, but there are very strong barriers there. Unless we try to understand those barriers, not from our perspective, but from their perspective, then try to make it kind of, it's a very gradual process, and it takes time. It is not overnight, just sit and talk to them. No, it won't work like that. Especially in the rural areas, especially when, these cultural issues, cultural matters a lot, and they are rigid, of course, they are rigid, but it takes a lot of time. So we need a lot of patience, humility, and also empathy with them as friends. Yeah, more than a counselor. Counselor, we cannot use that word also. They cannot understand that part of it. It is with them, to work with them. It's really a long process, I can say. And recently I mean, I had a long discussions with more than 100 people on the, especially with the child marriage issue. Very recently, I worked on that, and such a kind of barriers which really make the girl child not to come out of that. And so, as I think Nimisha ma'am was saying that, it's also like it's a family honor. It's so many things are related. Sorry, I don't want to take much of that, these issues, but definitely it's so complicated. It's not that kind of a thing simple, just sit with them and, give them some medicine or give them some talk. No, that won't work at all. It takes longer time, longer way of empathizing with them. And also, yes, definitely we need to share many other incidents, maybe our own personal incidents, so many things. We have to work in a different strategies to make them to come out of that. So that then only the real awareness will start. And with that awareness, education, then the transformative change will happen. Mere change, short-term change is not going to last unless there should be a transformative change. But that takes time. So thank you so much for giving me this opportunity to talk with you, share my
Thank you.
experience. Thank you so much.
Thank you so much, Sudhaji. And I would like to add one thing that you mentioned this thing. Definitely, you know, uh, we make it like a doctor and patient, right? But we need to make it like a team. Once there is a participating thing, not like, okay, I will tell you something and you need to follow. Teacher and student and doctor and patient, that relation should not be that way. And it should be like a team way. Professor Giri also mentioned that the participation, uh, the whole participation is much needed, and then only the thinking, that rigidity will go away and then thinking will change. Thank you so much for highlighting
I
that.
can see one request from Maria Barento. Would you like to ask something? Yes, please unmute yourself.
I think she's taking time, and in the meantime, quickly,
I would just add one thing to
just
so
one.
Nimisha was telling. No, just she was telling me it will take time. But what I feel personally is to be customized. I mean, tailor-made. Everybody's problem and everybody's response to the solution is not same. So this is one point just I wanted to add. Thank you.
Okay.
Totally agree. Yeah.
And very quickly, Sasibhushan Bhai, if you would like to share a thought, please.
Uh, I
Please
express
open.
my deep
Please open your video.
video. Actually, it's not functioning properly. Just audio, I think it's visible.
Okay.
And I express my deep gratitude to Professor Anant Giri and Professor Randhir, and also the two presenters, Amit ji and Nimisha ji. And really, I felt very much enlightened. As regards me, I am 66, and I spent a considerable time in the industrial areas situated in urban localities as well as in tribal localities, aided by a cycle expedition in 1995 from the dense forest of Jharkhand to Delhi.
Okay.
During the course, I found that I was lucky enough to be a student of Professor K.K. Mehta from Ahmedabad, who is a renowned psychologist, I should say, a behavioral scientist. And I feel that actually we cannot have a pattern where all the human beings and their types and variants can be fitted in. So the thing is that just by handling the people in a particular fashion may not lead to concrete results. I fully agree with Amit ji that the approach of Meher Baba, about whom I came to know in Bhaijak during a visit, and I was gifted a copy of his biography, I was deeply moved The thing is that he had the real spiritual approach, in fact, not the Baba type, typical Baba type and all that. Because talking to insane persons in close vicinity, very few of the practitioners or counselors can dare. So the thing is that let us have a new approach as such, because a lot of researches are going on all over the world. But let us see what our people need. Say, for example, the tribal people. We cannot handle in the traditional way of handling a tribal case and just having a straight jacket approach. If anything is coming out from that straight jacket, we cut it out. That is not the right approach. So let us have a holistic, integral approach while handling the human beings. I thank you, and I got a lot of input today, and I express my sincere gratitude to all of you. Thank you so much.
And now, Minati, please.
So, okay, I'll quickly read this poem from my book, A New Dawn. It is about actually the psychological aspect of, emotional aspect of every human being. At times in a full day, you may feel sometimes very fine, at times you may feel down. So, the title is Inward Journey. Am I mad? I am sad. Why? Is there any reason? Am I mad or am I sad? What is me? May or may not be. It is just passing of a season. It is just a passing of season, the season of love, the season of desire, and to be aspire, to inspire and conquer. Let me whisper, oh my dear tear, I let you roll down to make everything clear, my eyes clearer and mind brighter. The time hearts are heavy with cloud, and the hormones and my agitated views and new interpretations. The hovering emotions, images in the mirror and the metaphor. Images in the mirror and the metaphor of how the bow and arrow goes deep inside to reach out far. The metaphor of bow and arrow goes deep inside to reach out far. Thank you for listening.
Thank you. Excellent. So,
Thanks very quickly, Minati, for a vote of thanks.
Devendra sir is there, no? Not there?
I think Maria has joined.
okay.
But
Thank you so much. It was very good.
okay, thank you, Maria. Where are you from?
I'm from Mangalore.
Lovely. You can open your video for a moment.
Yes. I'm here.
Okay. Namaste.
Namaste.
Good evening, all of y'all.
Good evening.
It was nice session. Only thing, in the evening hours, it is a peak of, household work, no? So, better to plan maybe in the afternoon lunchtime.
Thank you.
Okay, we'll find a way.
All right. Thank you so much.
Thank you.
So, I would like to invite Dr. Tiwari. Dr. Tiwari teaches in lovely professional university, and he is our co-nurturer also. So, Dr. Tiwari, sir.
Thank you so much, sir, for asking me to propose the vote of thanks at this August moment. And definitely, I would say, particularly, I'm mesmerized to have our distinguished speakers and particularly their presentations and taking the queries on the topic, which is a dire need of present time. So thank you so much for asking me, and definitely as the tradition of our activities, I would like to begin this vote of thanks on behalf of SOHSS Circle for Co-Learning and RAIDS Global Foundation, Raffles University, I would like to express my deep felt gratitude to our distinguished speaker, Dr. Nimisha Vandan ma'am, and Dr. Amit Wanchoo sir, for making us learn so many deep aspects of mental health. And definitely, I hope my the participants will inculcate those suggestions to keep themselves healthy, and their surrounding healthy. So thank you both of you. I would like to express my deep felt gratitude to Professor Anand Giri sir for moderating the session and guiding us. Sir, a ton of thanks to you, sir. Thank you very much. I would like to express my deep felt gratitude to one of our very excellent discussant, Dr. Rakesh Thakur sir, for sharing his opinion very apt to the moment. So my thanks goes to Professor Dr. Rakesh Thakur. Our regular discussant, Professor Gyan Louis Gi sir, thank you so much for raising your query and question, which was very apt to the flow of the topic. Thank you so much. As usual, Minati Pradhan ji, for reciting her very appropriate poem and raising her issue. And particularly, I would like to say her opinion, particularly when she told that if you don't fit in a society, you are called a pagal or a mad person. It was very apt, and it is very much visible in every surrounding. So thank you so much, Minti ji, for giving your remark and presenting such a beautiful poem. My thanks to all the participants from all over the world. I would like to express my deep gratitude to Professor Randhir Gautam for planning, executing, and keeping us updated with this great topic, which is very relevant in the present context. So thank you, everybody. Namaste.
Thank you so much, sir.
Thank you. I have a complaint on Randhir's name. Can I tell now?
Sure, sure.
Yeah. See, the poetess is a grammatically correct. Okay, as we are nurturing the new thoughts, we should write poet as a gender neutral things.
Yes, yes. Sure.
So sorry, it's not my opinion. I wanted to tell you so many days back.
Okay.
But it is.
Okay, thank you so much. Thank you, everybody.
Thank you.
Namaste.
Thank you, everybody.
Thank you. Thank you. Bye. Take care. Good night. Bye bye.